Good afternoon. I want to thank everybody who joins us. My name is Olha, and it's my pleasure to welcome you at Ukraine Media Center today. Today we have invited you to talk in details about a program that was launched on the 1st of January 2026, the national program called 40 Plus Health Screening. The program was launched by the Ministry of Health of Ukraine in coordination with its partners, and it was meant for the people who achieved 40 years of age. So let me introduce our speakers. Joining us today are Viktor, Liashko, Minister of Health of Ukraine. Also joining us is Mariia Karchevych, Deputy Minister of Health, and Olha Danchivska, Family Doctor, Director of the Center for Primary Health Care of the Mostyska City Council. Thank you. Thank you for joining us today. That's a pressing topic, and it's important too. So, Mr. Viktor, the floor is yours. Let's talk about the purpose and who can take advantage, make use of the program. So, good afternoon. So, the program was launched on the 1st of January. That changes the logic of the healthcare. We don't want people to wait for the stroke, diabetes, or complication of the above sicknesses. We want people to identify risks in a timely manner and be able to manage them. In order to implement it, we launched 40 Plus health screening program. I'm frequently being asked, so how is it different from the family doctor who exercises the same type of examinations? Obviously, you can use the examination or communication with your family doctor within the medical guarantees program, but people do not prioritize their health condition, and they contact the doctors when they either have the first symptoms or irreversible changes. That's why before starting the program Health Screening Plus 40 Plus, we learned different pieces of experience from our partners, and we also coordinated some motivational things, saying that we allocate some money for the people, and as soon as you turn 40 plus years, 40 plus means like 40 and 50 and 70, so as long as people live, they will be able to get 40 plus health screening, and it will become a motivation for a person to report to a healthcare institution comfortable for them to undergo the examination. For the healthcare institutions, it becomes a motivation to invite a person to pass an examination on annual basis, so that the healthcare institution gets that money to use that for other types of motivation, for example, the procurement of necessary chemicals for 40 plus health screening. So our approach as a state is to identify the diseases on early stages, so people remain healthy as long as possible. For the people, it will be a motivation to take care about their health, to identify the risks, all the first symptoms, all the diseases, so that it's easier to manage them in the future. And the role of the state doesn't end there. After the screening, there may be consultations by the doctor, there may be prescriptions covered by affordable medicines program. And also for the year 2026, there is a number of measures to be implemented called Healthy Cardiovascular System. It will cover the installation of stents on a free basis. It will be covered by the medical guarantees program, and the medical products that were necessary for cardiovascular surgery were procured in the year 2025. So talking about 40 plus health screening, we're talking about monitoring and support for everyone who needs it within the free programs for the people. The program of medical guarantees Mr. Ear, why 40 plus? Why such a threshold? Why 40 plus? Because it was recommended that those interventions that are recommended after 40 plus years are usually recommended after the changes take place in the human body that people don't usually pay attention to. And today we stimulate the people to get diagnosed by the doctors, having necessary tools, having necessary tests completed. They identify whether the way of living, the way of, or the diet should be corrected so that people pay attention to their health, to control their first symptoms in case there are any, or to use medicines therapy or further examinations entailing probably even surgeries. Well, you've mentioned the international practices, and what were such practices and what European countries launched them? Almost all of them did. We see Poland, we see Great Britain, there are Baltic countries that work. And about a week ago, European Commission mentioned the heart protection plan. They checked the screening programs that were launched in different countries and which countries have not yet launched the screening programs with emphasis on cardiovascular diseases and diabetes. They've mentioned that such programs are supposed to be launched in the European countries, in the countries of European Union shortly. So why are we all talking about cardiovascular diseases and diabetes? Because as of now, 60% of mortality is cardiovascular diseases. Or for 40% of disability is cardiovascular diseases. Strokes, heart attacks are thousands of cases all over the country. Diabetes is about more than a million cases in the country, and we think that about 50% of the population are not aware of their diabetes diagnosis. So we try to stimulate the social economic life of our country, and the program will be modernized in future, but at the stage of the launch, we use this experience of our European partners. Now that we've added mental health emphasis, is it a world challenge? It is. We understand that we're almost through the year 4 of the full-scale invasion, and even before that, starting from the 2014, there was an annexation of Crimea and Donetsk and Lugansk regions. That's why we understand the conditions Ukrainians are living to. That's why the screen of the mental health, even within the global impact of the global events on the mental health, should be implemented. And in Ukraine, we make a special emphasis on this, and we do it within the framework of the program How Are You, initiated by the First Lady Olena Zelenska, which has already accomplished a number of things. For example, for the family doctors, we've implemented MHG program where we've passed all of the courses, and they know how to advise, how to identify the conditions. And for the year 2026, we want to revise the funding of the psychiatric aid when people need the qualified psychiatrists. And we try to do emphasis on raising tariffs to increase the funding of this sector. Thank you. So I suggest we should proceed to the route with Ms. Mariia so that the Ukrainians understand what steps needs to be taken to pass the screening. Good afternoon all. Thank you. So from the 1st of January, we've launched a 40-plus health screening program, which is a complex examination, the complex of medical interventions that help to identify the risks of the development of cardiovascular diseases, sugar diabetes, the problems of mental health, to identify them on early stages so that the doctors are able to provide medical aid on early stages in case people need that. The government approved a resolution in 2025 that regulates the procedure for screenings, describes the route and how the citizens can use that service. First of all, we need to mention that such health screenings basically will be able to be undergone in any healthcare institution, including state, private, and communal institutions. The list of institutions will be put together by the National Healthcare Service of Ukraine, and it's important that on the part of the government we've identified the requirements that the medical institutions have to comply with. Those are the requirements about the specialists, equipment, the level of service, to make sure that the screening service is a quality one and is affordable for the patients. For the time being, we have more than 400 applications from different healthcare institutions all over Ukraine, which express their desire to provide screening services, and the list is growing. It will be posted on the page of on the relevant page at the website of the Ministry of Healthcare of Ukraine. So the screening program includes laboratory examinations, physical examinations, anthropometry, arterial pressure management, evaluation of screening symptoms, and the studies that demonstrate how the cardiovascular system and the kidneys, for example, work. Also, it includes different scales in compliance with the international requirements, and the screening is being finalized with preventive consultation of a doctor about the further actions and healthy way of living. What's important is that all of the results of the screen are added to the electronic healthcare system, to the patient's medical card, so that the data is stored and family doctors could support the patients so that they could see the results of the screening. On top of that, within the year 2026, we expect that this program will grow in scale, and about 5 million patients of the 40+ years of age will be able to get involved to undergo this 40+ health screening program. The cost of service is 2,000 hryvnia, but it will be free for the patients. It will be covered by the government. The route of service is made of two aspects. We expect that the majority of the people will be using the digital path, using the DIA application. However, at the same time, for those who don't use DIA, we contemplated an alternative option through the Centers for Provision of Administrative Services. The online route looks as follows. The screening service is tied to a person's birthday. Why is it necessary? Because there's a lot of people in Ukraine of 40+ years of age, and to receive all of those millions of Ukrainians at the same time is impossible. That's why, in order to relieve the load on the healthcare institutions, we've come up with the algorithm tied to the birthday. So on the 30th day after their birthday, a person of 40+ years of age, it can be 50, 60, any number of years. It's important because people keep asking whether it's about 40 years or something around the date. So on the 30th day, a person gets a notification in the application that 40+ health screening service is available for them. After that, they may open a DIA payment card unless they did so before, or using the already existing DIA payment card to submit an application so that money is being allocated, and the term of application processing will be about seven days, after which an amount of 2,000 hryvnia will be credited to DIA payment card, and a person would be able to pick a healthcare institution, a list of which will be posted in the website of National Healthcare Service of Ukraine and Ministry of Health of Ukraine. Then a person may make an appointment for the screening. There will be special periods allocated, including morning and evening hours, and additional block on Saturdays, so everyone can pick a comfortable time. People make an appointment, they undergo the screening, pay it with Dia card right on the spot, and then the results are being added to the national healthcare system, and the citizens get the results of the tests. Online route or offline route is pretty similar. Instead of ordering a card through Dia, a person may order a plastic card in partner banks. The first bank to partner with us is Privat Bank, and then has to apply to a nearest center for administrative services. An employee of the Center for Administrative Services submits an application for a citizen, and such citizen gets the amount of 2,000 hryvnia credited to their plastic card, and then the procedure is the same. They may pay with that plastic card right on spot. Currently, we have 11 million users of Dia application of Ukraine, so we expect Dia to be the key route. But should it happen so that someone is not using Dia, there is an alternative way. We also have a dedicated page for the program where we provide all of the answers to the questions where the healthcare institutions will be located, along with all the necessary information to get involved in the program. Right away, I'm having a question. Ms. Mariia, you said that citizens may use any institution, including private or state-controlled. So is it somehow tied to their place of registration? Should people pick some institution nearest to their place of registration? No, it doesn't really matter. It depends on the probably where they have a declaration with the family doctors that would be more relevant. So, Ms. Olga, what comes next? After people submit their applications, get an appointment approved, and when they come to you, what should the citizens be taken into account? Well, first of all, the citizens are supposed to pick their healthcare institution either through registration office of a healthcare institution using a phone or through healthy.me. But I would say that to undergo the screening, you better pick your family doctor, because no one knows your health better than them. Obviously, you will already have some trust built between you, and when you address them, it will be just more comfortable for you. And when you come to your doctor, you will have 60 to 90 minutes dedicated to you. The maximum number of visits is 3 within the program of screening, but it doesn't matter that you cannot make an appointment with your family doctor other than related to the screening. So what do we do during this examination? First, there will be a questionnaire, an important block to identify the risks. The risks of these or those diseases. There will be the SPOR scale to identify the risk of cardiovascular diseases, the risk of diabetes, audit, the scale to identify the risky use of alcohol, and there will be 2 more scales to identify the risk of depression and anxiety. After that block, there will be a physical examination that we are all familiar with. Your family doctor can do it. It may as well be done by a nurse in an institution where you make an appointment at. It includes anthropometry, cardiogram, and sometimes what happens is the white gown effect, as people get scared and their blood pressure rises. So what will help is a repeated blood pressure screening. The institutions that join the program will get the necessary blood pressure management equipment supplied that can be issued for the person on a one-day basis and can be returned so that the citizens could measure their blood pressure at home by themselves. Also, we analyzes the glycosylated hemoglobin. It demonstrates the level of glucose within the last 3 months, and it may identify the risk of diabetes. And in case of necessity, doctors can make a blood test for potassium or natrium, and to identify your kidney operation, the doctors will make a test of creatinine and albumin. It will help the doctors identify your condition of your health multilaterally, and on the following stages of advice, you will be able to pick a necessary tactics with the doctor, the one that will be useful and efficient in your case. Why is that important? That's a proactive joint position, because in that case the patients will be involved in the process of support of their health, because usually we put that responsibility on someone else, providing too little of the input of our own. And the majority of the doctors were already through different trainings, including in my institution, on motivational advice. The doctors will try to do their best to change your way of living, so that if they identify some risks, to do so that they don't progress. The doctors will be able to pick a necessary treatment course for you using the affordable medicines program. For example, in case a patient gets identified the risk of hypertonia, the doctor will be able to prescribe the necessary medicines. We are prepared to the fact that many people never underwent any screening, and we may identify diabetes during the first screening, but the route will be put in such a way that we continue supporting the patients on the further stages of treatment. So how long does the screening take? The envisaged time is 60 to 90 minutes per patient, and then a patient gets a list of recommendations. Right, if we identify any risks, we invite the people for the next visits depending on the level of risk that we identify. The time period should be sufficient for us to identify the risk of complications, but it doesn't necessarily mean that after the screening people cannot come to their family doctors again and to continue the treatment. That's why it's important to undergo the screening with your family doctors. There will be cause and effect. Dear colleagues, we would like to give the floor to you. Good afternoon, Irina Zhdanova. My question is, what are the laboratory tests that will be included in that screening, and how is it united with the fact that it all should be done within one visit? The clinic should be equipped with the laboratory and all the necessary equipment, for what we understand. Okay, when it comes to the list, that will be responsibility of the doctors. But what's special about it? Those institutions will be involved in the screening program that will be capable of fulfilling the screening within 1 day. So it's a blood and urine test, most of all, cardiogram, blood pressure. But again, it depends on the healthcare institution, and the doctors already need to have the results of the test within 72 hours. That can further be sent to a patient through their email. So when you were asking why did we contemplate the screening program not only for the family doctors but for other doctors, you see, it's all about the competition. For example, a family doctor has already invited their patients to come to them twice, so that was our motivational component that we added. And when it comes to the tests, I would like to ask Ms. Olga to tell about it. So we've mentioned, or we didn't mention, a necessary person who will guide the patients, a coordinator, a person who meets you before you come to the doctor and then guide you, like here is the doctor there, or right there may be a blood test, to minimize the time of your visit. Also, a mandatory precondition is the message to a patient. Our institution will either send a printed notification or a text message to the persons, and it will be looking like a traffic light, red, yellow, and green, which are supposed to be motivating the patients to treat the risks that were identified during the screening. When it comes to the tools of the testing, that will be cardiogram and blood pressure management, in case necessary on a 24 hours basis, and other tests, potassium, natrium, electrolytes, lipidogram, the kidneys function, creatinine, correlation of albumin and creatinine in urine. More questions? Anna Seleznak, Suspilna News. For what we understand, that examination includes cardiovascular system, diabetes, and mental health examination. Can people use that money for examination of some other diseases in case necessary? And can also that amount be spent, for example, only for a psychiatrist's appointment in a private clinic? It's only about mental health. It's just one article from that list that you've mentioned, but or are the patients supposed to undergo all the three components? And I'd like to ask about a little bit more about the details. So it won't be a one-off support, right? You want this program to be taking place on an annual basis, right? It's an annual program. And will the patients be able to spend that amount for anything else? No, the program is planned in such a way that a healthcare institution have a dedicated terminal that can read a special code so that that amount is credited on the account of a healthcare institution. It's a motivational component so that the healthcare institutions understand that the patients have this money and the patients understand that they have it and they can spend it in a medical institution. If it is covered by the program of medical guarantees, the patients will be able to get a psychiatrist or a psychotherapist appointment in case necessary under the program of medical guarantees. Ms. Olga, you're inviting the patients for the screening, but in fact, how is it different from what the family doctors do now? How is it different from this program? Well, it's my favorite question. The family doctors do all of that, but it's about proactive position of the patients to address the doctor and to get examined. Now the family doctors, they call, they invite, but they have no other methods of influence over their patients. Psychologically, people are more prepared to do something when they have certain obligation, and for many, this amount of 2,000 hryvnia for examination may become such an obligation to take care about their own health, that it's something personalized, not for someone else. So basically, everything, all of those examinations can be undergone now, even without waiting for your birthday. Yes, the only difference that within the screening, the healthcare institutions will be obliged to take your blood test within one test, because if you come to a doctor, it usually looks different. You come to a doctor, they get you a prescription, and then on the next day, for example, next morning, you go to a laboratory to provide the test materials. And Now the healthcare institutions will be obliged to take the test in one day, and not all of the people can do so when they, for example, work. It requires the presence of necessary equipment such as centrifuge so that the blood specimens could be preserved until the next day. And a question to Viktor Liashko. Now there is a reform meeting of the government. Did you get addressed in these terms to take any other office? Well, currently I'm in the office of the Minister of Health, and we're launching 40+ health screening program. And I invite everyone to take part in this program, because as a Minister of Health, I'm still responsible for that. Hopefully we have more questions related to the topic. Well, you've mentioned that the program will be working in certain medical institutions that will be eligible. So how will the patients from other places where such healthcare institutions are not available will be able to pass this screening? Will they be supposed to come to bigger cities, for example, for the screening? Well, now we're talking about 391 institutions which submitted applications, and the number will be growing. But we try to verify all of the institutions. We call them, we survey them to see that the service part will be functioning there, so as like Ms. Olga said, so that it will be convenient for all of the patients to undergo the screening in those institutions. In case there are no healthcare institutions available nearby, soon we will be launching the mobile teams. Probably we will identify some gaps in the organization of this process, fix them, and then proceed to another stage, to the second stage, in coordination with the family doctors, because before this program, before 40+ health screening program, we had consultations in the centers of primary medical aid with the doctors and ambulatories. There were discussions about the requirements, about the organization of the screening progress. Now we have a coordinated position that was launched, and we need to see the results of its operation. Good afternoon, Irina Andreitsev, Zdоровье section in lb.ua. I have questions about KPIs of this program, because a lot of family doctors were mentioning the health check program available in Great Britain, and the survey showed that there were no significant changes as to the identification of the risk of cardiovascular diseases. So what are our KPIs? It's like not to identify 5 million of cases of risks, but also about supporting them. Thank you for the question. Our key task is really to reduce mortality and disability resulting from cardiovascular diseases, also to identify the mental health conditions and metabolic defects such as sugar diabetes. The key task is, if we analyze what happened within the last 5 years that I was in charge, we can see the routine of the patients with heart attacks or strokes, then what happens in the healthcare institutions, what are the medication processes taking place. And talking about the routine, I'm saying that 95% of the cases, the ambulance bring people having suspicion of a stroke, suspected cases of stroke or heart attack, to the dedicated healthcare institutions. Then we take necessary tests. In case of stroke, we use the thrombolysis. Then as soon as we analyze what happens, why people are not being applied thrombolysis, there is the process when people are being injected medicines that make the thrombus dissolve. And we check the number of visits to a family doctor, whether the patients had medications, did anyone explain their risk or the symptoms of the heart attacks or strokes, so that they could call right away when the symptoms emerge, or rather than after 6 or 9 hours, when the medical aid would not be so efficient. So as we said, the indicators, we try to identify what we try to achieve. So we want to motivate Ukrainians to undergo 40 plus health screening program. We will compare it with the existing results of the studies. We can talk a lot about different indicators, but we can also check the scientific publications that we were taken for the analysis and identify what intervention among those interventions that we use are the most efficient. If you think that there was no political pressure on me as a minister, like why only these tests, not, for example, ultrasonic examination of thyroid, but we were taking the experience of our foreign partners to identify what are the risks, and then we analyze how many times people were reporting to their family doctors or were reporting for outhouse. Thank you. Another question, a little bit more details that I would like to ask about. The program was launched on the 1st of January, and how many people were already using this service? And a question to the minister, are you going to use the screening? And a question to the doctor, so can you please tell us in simple words what are those blood tests? Well, I'm 46 years old and I'm definitely going to make use of this program. So whether there is a lot of people who have already used the program, again, it's the day of your birthday, the date of your birth, and 30 days after that you receive a notification to your DIA. Why do we do so? To make it in a cascade manner in order not to create an overload within the first days the program is launched. We want to avoid the lines, during some seasons, when people have more free time. It's like when children come to school on the 1st of September and they had to get their health certificates in the hospitals. And there was a lot of people huddling in the healthcare institutions. That's why we decided to tie it to the date of birth to coordinate, so to say, the queue that may emerge. And Ms. Olga, if you can tell us more details. Well, for example, our institution expects to see the first patients not earlier than on the 8th of February, because there is also plus 1 week to get the amount credited. Our patients have already called us to make an appointment, and the patient coordinator is really of help here, because they can support the people logistically, they can help everyone. So talking about the tests, we can break them down into a number of blocks. First is metabolic, glycosylated hemoglobin, for example. Another is lipidogram, which is cardiovascular diseases risk. For example, there will be 5 tests that will show whether you have a high risk or high cholesterol, for example. And the most complicated part is the electrolytes. That test will only be done in case of prescription. If there will be any defects in the development of cardiovascular system of a patient, such tests will be prescribed to identify the defects of the heart muscle operation. Also, There will be another indicator for kidneys that shows us how efficiently the kidneys work to get rid of the metabolic products, and correlation of albumin and creatinine will demonstrate the balance of those things in the urine. And what's special about all those tests, you don't have to prepare specially for them. You don't have to stay hungry. You don't have to observe a diet. You just come to a doctor and pass all of the tests. Well, since the moment the money will be credited, how long is it going a person to take to undergo the examination, the screening? Well, it will depend also on the availability of the healthcare institution. Well, the persons will be able to use those funds until the 17th of December 2026, save for those who have their birthdays later than 17th of November. And talking about this DIA payment card, are people supposed to get the DIA payment card issued? If a patient uses an online route, they can get a DIA card issued digitally. If they use an offline mode, they will be able to get this card at private bank issued. So the patients use that card to pay for the services, and all of the healthcare institutions are supposed to be equipped with POS terminals. That's a necessary requirement for them under the program. Any more questions on the floor? Valeria Nikopelova, Apostrophe TV channel. Mr. Minister, you've mentioned that you expect to see about 5 million patients who want to undergo the screening. Meanwhile, Ms. Mariia mentioned that the number of the patients 40 plus years of age are registered in India is more than 11 million. So the ministry was developing the program for all of the patients of 40 plus years of age. Definitely, as soon as you launch the program, it doesn't get this efficiency momentum that will be growing in the future. We've experienced that in a number of national campaigns. That's why we have an agreement with the Ministry of Finance, who accumulate 10 billion with the reserve. If we can see, if we will be able to see that the number of the Ukrainians who want to pass the screening will be growing, then we will be able to allocate more funds. 5 million is a component that we are ready to receive. That's is it the maximum plan? No, it's a minimum plan, actually. Okay, so any more questions on the floor? Good afternoon, Diana Slavinska, Ukrinform. First of all, my colleague was asking a question about the number of the people who have already used the screening. And talking about the readiness of the healthcare institutions, you've mentioned a number of those who submitted applications, but what about the number of those who are in fact prepared? Well, using this service, for example, if your birthday falls on the 31st of January, or on the 1st of January, then on the 31st you're getting a text, you're getting a notification. That's why until this day no one was able to use this program, because it's launched now, and now we're talking about 391 institutions that are prepared to receive the patients. We keep verifying them within the process of their expectation, of their waiting for the patients who are ready to come and to undergo the screening. The patients are getting their payment cards. So basically, the first patients are coming to the healthcare institutions on the 8th of February. Seems like there are no more questions on the floor. Thank you for coming and sharing information about the launch of the program. Hopefully there will be at least 5 million of Ukrainians who come to the healthcare institutions to get their health checked. And I would like also to thank the security and defense forces, thanks to whom we can hold events like this. Thanks everyone. Glory to Ukraine. Glory to the heroes.